Hello everyone, welcome back to Dubai Healthcare Consultancy. As you know that Dubai Healthcare Consultancy assists doctor, nurses, pharmacists and allied healthcare professionals who are interested to start their career in Dubai, Saudi Arabia, Oman, Bahrain, Qatar and Kuwait. So if you are interested to start your career in one of these countries, I believe that Dubai Healthcare Consultancy is the best platform to assist you for your health authority registration, data flow verification, and license exam booking. Dubai Healthcare Consultancy will also provide you the exam material, and also we will provide you our question bank, and these exam material and the question bank will help you to prepare for your upcoming Prometric and Pearson VUE exam. Please note here that these exam materials and question banks are just provide you the guideline and just provide you assistance for the preparation of Prometric and Pearson VUE exam. These are not the official Prometric and Pearson VUE exam question. So let's go. Today the video is about to all these questions we will discuss in this video is about physiotherapist. If you are a physiotherapist and you are preparing for yourself for Prometric exam and Pearson VUE exam, so 100% this video is belong to you. In this video we will discuss some question and we will also give the rationale for those correct answer, and I hope it will increase your knowledge about different topics related to physiotherapy exam. So let's start our video. First question I am going to share with you. Here is the question is on your screen. A physical therapist is reviewing the medical record of a patient with venous insufficiency. The physician has ordered a diagnostic test to determine whether the patient has a deep vein thrombosis. Which of the following tests would be the most appropriate? So always will read the question, okay, and understand what the question is asking, and then read all four options and then compare which option is related to the question. Okay, so then you make your clinical judgment and also use your theoretical knowledge and decide the correct answer. I hope this technique will help you. So option A, pulmonary function test. Option B, pulmonary partial thromboplastin time. Option C, hematocrit. Option D, ultrasonography. Which one is the best answer? I think you understand now very well, and I hope you will agree with me, and option D is the correct answer. Why option that is Doppler ultrasonography? Why option D is the correct answer? The rationale is here. Doppler ultrasonography is the most commonly used and reliable diagnostic test for detecting deep vein thrombosis. It uses sound waves to assess blood flow in the vein and detect blockage caused by clot. Other options do not provide direct imaging of venous circulation. Let's move to question number 2. Question number 2. While analyzing a complete blood count for a 60-year-old male recently admitted to the hospital, a physical therapist notes a specific lab value that may indicate the need for precaution during therapeutic exercise. Which value would warrant concern? So use the same strategy and now go to the four option. Option A is platelet count is 250,000. Option B, hemoglobin is 8, and option C, hematocrit is 46, while option D is white WBC count is 5,500. So which will be the best option? I give you a little time to you, and I hope you are agree with me. Option B is the best option, and that is the correct option. Why option B is the correct option? Hemoglobin 8. A hemoglobin level of 8 is significant below the normal range, typically 13.5 to 17.5 for men, indicating anemia. This can lead to reduced oxygen carrying capacity and fatigue, making strenuous exercise unsafe. Now let's move to question number 3. A patient with a low back pain described Undergoing. Describe undergoing diagnostic testing monitoring. That a dye was injected into the spinal canal. Which imaging study best matches this description? Computed tomography. Computed tomography. Option A. Option B is arthrography. Option C is magnetic resonance imaging. Option D is myelography. The correct option is option D. Why option D is the correct option? Because myelography involves injecting a contrast dye into the spinal canal to assess abnormalities such as herniated disc or spinal stenosis. This description does not match MRI, CT scan, and orthography. Let's move to question number 4. Physical therapist is reviewing a patient with adhesive capsulitis. Which of the following medical condition is most commonly linked to an increased risk of developing this condition? Which condition is linked to adhesive capsulitis? Option A is osteomalacia, option B is peripheral vascular disease, option C is diabetes mellitus, and option D is hemophilia. Which one is the best option? If your option is option C, so you are 100% right. Diabetes mellitus is the correct answer. Why? The rationale is diabetes mellitus is a well-established risk factor for adhesive capsulitis or frozen shoulder. The exact mechanism is unclear, but it is thought to involve increased inflammation and fibrosis in the shoulder capsule. Question number 5. A physical therapist working in an oncology unit is reviewing the patient blood workup before initiating exercise. Here again, we are talking here about the blood lab value. So the patient values are hematocrit 24, white blood cell count 2500, platelet 80,000, hemoglobin is 7. Based on these findings, which of the following exercise recommendation is appropriate? A. Active exercise is allowed. B. Restrictive exercise is allowed. C. No exercise is allowed. And D is light exercise is allowed. Which is the correct option you will go for? If you are going for option C, so you are 100% right. Option C is the correct option. Rational, the no exercise is allowed. Rational, the patient hemoglobin and hematocrit level are critically low, suggesting severe anemia. Additionally, low platelet and WBC count indicate an increased risk of bleeding and infection, making exercise unsafe. Now you understand why the rationale is important, to understand why something is going well and why something is going wrong. Question number 6. A 48-year-old woman with 20-year history of heavy smoking has been diagnosed with a lung cancer. When determining the most effective treatment plan, which of the following piece of information would be most critical? Option A. Motivational level. B. Staging of cancer. C. Permorbid lifestyle. Option D. Past medical history. Which is the best option? Which is the correct option? I hope you all agree with me, and option B is the correct option. Staging of cancer. Rational, the staging of cancer provides essential information regarding prognosis, treatment option, and physical therapy goal. Motivation and lifestyle factors are relevant but secondary to cancer staging. Let's move to question number 7. A physical therapist treating a patient 3 weeks after a medical meninectomy. Note that the patient recently experienced a mild fever. The therapist measured the patient temperature at 98.9 degree Fahrenheit, which is the most appropriate course of action. You need to understand patient has a that's procedure, and after procedure the temperature is 98.9. You should know which is the normal value or abnormal value. If it is normal value, so go to the option and focus on option. Each option is idea, main concept. And if you are matching those main concept to the question, so I hope you will not struggle to find out the correct answer. Option A. Contact the surgeons for further guidance. Option B. Continue treatment is planned. Option C. Continue treatment but avoid active exercise. Option D. Refer the patient to the primary care physician. Which one is the correct answer? And I hope you are agree with me, and the correct option is option B. Continue treatment is planned. As I told you, 98 degree Fahrenheit, it's a normal temperature. So a temperature of 98.9 degree is within normal range unless the patient shows sign of infection, which for example swelling, redness, persistent fever. Physical therapy or therapist will then can concede is usual. Okay, now you understand. I hope you understand well. Now let's move to question number 8. A physical therapist is reviewing the lab result of a 40-year-old female diagnosed with myasthenia gravis who is recently on immunosuppressive medication. Which of the following tests should be monitored most frequently due to the patient's medication regime? A. Hematocrit. B. White blood cell count. C. Platelet count. D. Hemoglobin count. Which is the best option? Related to patient diagnosis, immunosuppressive medication, all these type of word you need to keep in mind and then go to select the best option. Use your clinical knowledge and use your theoretical knowledge. And the option B is the correct answer, white blood cell count. And why option B is the correct answer? Immunosuppressive medication reduce white blood cell count, increase infection risk. Regular monitoring of white WBC level is essential to prevent complication. Let's move to question number 9. A 23-year-old female with a lower leg pain was referred to physical therapy after undergoing diagnostic imaging to rule out a stress fracture. Which imaging technique is best suited to or for identifying a stress fracture? Option A is X-ray, option B is bone scan, option C is bone densitometry, option D is orthography. Which is the correct option? The correct option is option B, bone scan. Why bone scan is important? Because bone scans are more sensitive than X-ray for detecting stress fracture, especially in the early stage when X-rays may not show any abnormality. Let's move to question number 10. A physical therapist evaluate a patient with acute grade 2 lateral ankle sprain. Which of the following mechanism is the most common cause of anterior talopubular ligaments injury? Option A is inversion and plantar flexion. Option B is inversion and dorsiflexion. Option C is eversion and dorsiflexion. And option D is inversion. Which is the best option? The best option is option A, inversion and plantar flexion. Why? The rationale is the anterior talopubular ligament is the most common injury during inversion and plantar flexion, such as when leading awkwardly on the foot. I hope this question will help you to prepare you for your upcoming Prometric and Pearson VUE exam. If you need more help, you can contact Dubai Healthcare Consultancy. You can contact on our phone number. Either you can call us, the number is on your screen. Either you can simply send us a WhatsApp message, and Dubai Healthcare Consultancy will assist you for your health authority registration, data flow verification, license exam booking. Thank you so much for watching this video. Please subscribe our channel so in the future when we will upload more video you will get the notification. Thank you.